question that came in. Hi, Dr. Doreen. I was wondering something. In your experience, if a child demonstrates extreme hilarity that is not usual for that child, what could be the cause of that?
Well, that's actually a really good question. I guess I've seen that a few times with some of our kids where they're just laughing and you can't really tell what's causing it. Mm-hmm. And not that it's absolutely the cause, but often when these situations happen and I continue to ask stories of the parents about the diet of the child, it tends to have some relationship to a yeast die-off type reaction. And when you have, if your child is a child who has some fungal issues or yeast issues, and you are perhaps treating the child or have the child on either antifungal medications or on a diet so that the child's yeast levels would be going down, then you might see something like that during that time frame, because it's, yeast die-off experience is kind of like being intoxicated with alcohol. Is similar. So that might be one of the reasons. Mm-hmm. In some cases, some of the kids think something and they're not verbal enough or able to differentiate that what they're thinking you can't tell. Mm-hmm. So they'll be laughing about something and they won't be able to express to you what it is. Mm-hmm. So those are, I guess, the two avenues I would ask questions about or try to investigate further.
And if it's the yeast, it's probably going to happen a little bit more often than if it's just something that they happen to find funny. I would think, right?
Absolutely. If it's repetitive and it's not really associated with a particular event or time of day or activity or something like that, then more likely it is something biochemical, and that's where I would be looking. And by the way, I mean, it will gradually go away. You want to make sure that, and sometimes, having said that, some of our kids react that way just on sugar. You give a child a lot of sugar or various other types of food additives and they'll become kind of silly and giddy. So that's more of a dietary type thing, and maybe when Julie comes on we can talk to her about that as well. Too.
My child is very yeast reactive. Not as much as he used to be, but we used to, before he was diagnosed even, we would call him the drunken elf. That he would eat something and he would act like a little drunken elf. And not always a happy drunken elf, can I just say.
That's
sometimes we'd get the happy drunk and sometimes we'd get the maudlin, very unhappy drunk. It was not fun. But with dietary changes, we did see that, and now we just try to be very careful, but we can sometimes get a child who's just left of center.
And you know, it's amazing with kids who are reactive to yeast. They have, like, you can test this. Once they're off, once their candida level is normal, you just give them something that is that provokes it, and oh my gosh, it's an immediate reaction. You can see the kids like just going into this phase of silliness for a while.
Absolutely, absolutely. But we'll make sure that we ask Julie about that a little bit later as well, because we are going to be joined a little later in the program by Julie Matthews from Nourishing Hope. So you won't want to miss that. Okay, let's move on to another question here. Is it appropriate to tell your child they have autism, and what age would you explain that to them? We've had many questions in the past too about not only that, but how do you language that to your child?
That's such a broad question, and it's very hard to answer because I think there's so many factors involved with this. First of all, families have very different perspective on this issue. So there are some families who actually really never want to get too much into it, other families who really want their children to know, and then on the other side of it, some of the families want their kids to know when they're very young and in treatment so that the child understands why there's all these people coming and what's different about me. And other parents tend to tell their kids after the child's kind of come out of it or is pretty much recovered. So those factors you have to take into consideration. I think for me, if it was me, I think that I would have to ask myself the reasons that I would want to share this with my child first. And perhaps one reason would be if the child is feeling embarrassed at school, or if peers are making fun of the child, and if the child has the understanding where you can explain it. But however you explain it, you have to make sure that you don't get too technical about it. The way that I approach it with my kids is just to say, yeah, just like someone else needs math tutoring, you maybe need some tutoring for language. And, you know, this is just some ways to teach you how to get friends and socialize, and it's not a big deal, and you can overcome it. And I downplay it a lot because I don't want my kids to feel in any way different, stigmatized, or that sort of thing, but I want them to be able to understand why they have difficulty in certain areas. So that's kind of the difference. Like if a child is feeling confused or upset, like why can't I do the things that these other kids can do, then it might be appropriate to talk to the child about the fact that, hey, you've really learned, everybody has some area that they need to work on. We're working on this with you. It'll get a lot better. And that's really how I kind of want to make sure you're not damaging the child's self-esteem.
Yeah.
A lot of times parents don't need to do this while the child is in therapy, and it's funny because so many of our kids, as they start to recover, they actually hear about it and recognize it themselves, and they'll come back and say, I think I have that, or that sounds like something I would do, or something like that. And so then it's appropriate to explain it, I think, to higher level kids, or kids who are almost at the end of the program or have the comprehension, and to just kind of say that, yeah, it's just that, you know, you needed some help with language and social skills, and that's it. I would really downplay it, because I don't, you know, for a child, a label like that could potentially be damaging. And, you know, anyway, who cares about the label? It's changing again in May. You know, so.
With a lot of trepidation, actually, around the change in May. You know, we saw it last summer, the way that the DSM-5 was written at that time, and we could write in and make recommendations. Then, of course, they pulled it down, and none of us have seen it since. And now, have you seen it since?
Yeah. I don't think there were too many changes that occurred after the public feedback, and I will look into it, and if it's actually definitely going to come out in May, maybe in the next couple of shows we can talk about it a little bit and review it.
Love to, because I know a lot of people have concern about what happens on that day and what's it going to mean. And I know my question was, how long is it going to take? Because clearly they're going to have to train people to be able to diagnose it, aren't they? Or should we save that for another show and we'll just talk about all that?
In terms of the training, when I was training on diagnosis, I think we were on DSM-3 maybe. I don't even remember, 2R or 3, I would say. And then after that came 3R, and then 4, and then 4R. So I've switched diagnostic manuals several times now through my career. And I think if you're a clinician already, it's basically expected of you to be able to identify, understand the differences.
Read it, understand it.
If you are in training right now, then you're in bad shape, because that's exactly what happened to us, actually. We were in training, and we had heard that a year later DSM-4 was coming out, or something, 3R or something, and so we had to learn both.
Wow.
So in training, you'll probably have to learn both. It's not a huge issue. I mean, I think personally, when I read it and commented on it, I thought that there were some improvements to it. I think that it actually, my feeling about it is that, first of all, it's a spectrum disorder now. It's very clear that it's a spectrum. It doesn't have all these subdivisions that used to be there. They've taken out Rett's, which is appropriate because that's a genetic disorder. They've gotten rid of disintegrative disorder, which none of us used, and it was kind of a useless term. They've included symptoms of Aspergers. They've included sensory issues. That, to me, is massive. Like, to have that in there. So there are certain, and then they have levels now. And I think the levels will actually become very critical, because the levels have to do with the amount of support the child needs.
Yeah.
So once you receive the diagnosis, and currently we don't, you know, and if I give a diagnosis of autistic disorder, autism, to a child, the child could be high functioning or low functioning, but as long as they fit, I have to give them that diagnosis. So to have the ability now to say, sort of, child has autism at level 2, it indicates right off the bat how much support that individual needs right now.
Okay.
Now, so that's kind of a good thing.
Right.
My only fear with this change is that I'm certain that funding agencies will start to use those levels to identify how much more intervention the child needs.
Yeah.
That I'm concerned about, because, you know, if I say a child is at a level where they don't need a ton of support, that doesn't mean that I won't need, like, let's say, a certain amount of support for 3 or 4 years.
Right.
And I'm afraid that there'll be problems with funding. But we'll see.
I think we're all concerned about that. But you're right. We'll wait and see. And there are good people such as yourself who fight for us when that happens.
Oh, absolutely. And I'm sure there's, you know, you can write a lot of detail into what the child needs to. But yeah, I mean, we can certainly pick a week and talk about the DSM coming out.
We will absolutely do that. Somebody else, I've got a question about food that I'm going to want to talk with both you and Julie Matthews to get both of your takes on it. But somebody wants to know, what can I do to help my child calm down when he's screaming and very impulsive, hyperactive? And we don't have an age, which makes a difference, I'm sure.
Right, and we don't have an idea of the function and what's maintaining that behavior. So I guess what you'd have to do is identify those things. So always when you want to change behavior, Shannon, as you know, you have to identify what are the antecedents and consequences. So what's happening right before this behavior and what's happening after it. What happens after it is usually the thing that keeps it going, and the thing that happens before it is usually the thing that triggers it.
Right.
So you have to ask yourself, like, when is there a specific setting in which he becomes hyperactive? What were the terms that the parents used?
She said, calm down when he's screaming, and very impulsive, hyperactive.
Right, impulsive, hyperactive. So first you look at the setting situations, the antecedents that are setting related. So you were like, okay, this seems to always happen in front of the TV. This seems to always happen when there's other kids around. This seems to always happen outside. All of those factors give you information. For instance, if it happens when the child's on a playground or outside, the noise level might be stimulating the child. When it happens, let's say if it happens in front of the television, it could be that there's something on TV that's sort of a self-stimulatory, repetitive thing that excites the child, and this is his way of expressing excitement. So you kind of have to analyze the antecedents. If you find that there is no antecedent, then we go back to the original question that someone else asked, and then you're looking at biochemistry causing this, and you know, you're not identifying a specific setting factor or time of day factor that relates to this. Then you're possibly looking at things like sugar intake, red dye, a lot of people tell me causes hyperactivity. Again, things that might be causing an increase in yeast or fungal issues. So those are all things, you know, sleep actually has a big impact on hyperactivity. If a child is not sleeping enough, they tend to become over hyperactive for a few days. Those are all the factors that I would be looking at. What you on the consequence side, the only thing you want to make sure is that, and I'm just making the assumption, if the child is very hyperactive and sort of not able to pay attention to anything, you just want to make sure you're not rewarding that. That's all you can do, really, because, you know, that kind of hyperactive behavior where the child isn't able to inhibit themselves is really, there's not much you can do with the consequences of that, because usually the child isn't doing that in order to gain something. They're doing it for self-stimulatory type purposes. So, you know, just not enough information, but I guess that's what you would want to look into.
And let me ask you, just as a follow-up, because I was talking to a parent the other day, and I was talking about the importance of keeping a behavioral log. And I was showing him how to do like the three columns, and doing the A, B, and the C, the A for the antecedent, the B for the behavior, the C for the consequence. And I said, and this is great because you start to see patterns, but really it's great to hand off to an expert.
Absolutely. And you know what else is really important is if you can add the setting and the time, because often we forget to look at the time of day. That's very important, and the setting.
Yeah.
Because behaviors change pretty significantly from setting to setting, or even from morning to night. So. And also, as you're doing this, and when you write antecedent, the A column, which is like just what happened before it, look at other things, like look at food that the child might have consumed within the last 24 hours that might be affecting the behavior. There's so many factors that you have to analyze.
And that was the point that I was making, because the example from our experience that really gets me every time, my son was having tantrums in one particular grocery store every time we would go in the same area of the grocery store. And I kept the little behavior log, and I wrote everything down and talked about what was happening before and so on and so forth. And after I handed that in, they said, we're going to go out to the store to see. And I could have done a behavior log the rest of my life. I could have thought it through the rest of my life. I would never have been able to identify what they identified. The floor changed right where he was having the tantrum. It went from a very slick surface to a tiled surface that had a texture
pattern
to it.
Or a texture.
As a parent, I would never have caught that.
Right.
And what they did was they and I didn't realize that we were having that behavior in other places where there was a floor change, where there was a tiled grid floor. And that for whatever reason, visually, he wasn't handling that. And so they systematically desensitized him to that. And it was amazing, the difference. And every time I'm in that grocery store at that point, I'm reminded and humbled by the fact that I would never have figured that out.
Right.
My child would still be having tantrums there.
Well, it's interesting because we forget. I mean, we talk about this all the time, but we tend to forget that our kids have dysregulation in their senses. So the way they perceive the world is pretty different.
Yeah.
And what you're trying to do, and we do this through our programs in ABA, is you're trying to desensitize them to the abnormal reactions that they have. Basically, you have to imagine that for a child that has visual perceptual issues, what they're seeing perhaps is too confusing. Let's say for us, it might be, it looks like you're walking on snakes.
Yeah.
I don't know. It's something that provokes either anxiety or fear or some sort of chaos. And they can't really, feel stable where they're walking. Or it could just be distractive. Like for a lot of kids, auditory stimuli tend to make them very hyper because, I've said this many times, some of my kids will say that background noises are so much louder for them.
Yes.
And so being able to tune that out is extremely hard for our kids, and so sometimes sound makes them very hyper. So we have to remember that they have sensory issues.
Yes, absolutely. But and also my point is, though, that sometimes it's just so essential to work with an expert. You get things done so much quicker.
Absolutely. It's a lot harder, especially, even like I would have a hard time with my own kids if I wanted to. As a parent, it's just harder. You see things differently.
We always like to joke that we have eyes in the back of our heads, but we don't.
Right. Absolutely.
It's a lie.
Right.
Okay, an interesting question. Is Asperger's something you are born with?
That's a wonderful question, and I guess I could ask, is autism something you are born with? I believe that you're born with the genetic predisposition to the spectrum. So I would say, to answer your question, I guess yes. That's fair enough to say yes. Because especially with Asperger's, Asperger's kids are just so unbelievably off the chart intelligent in one way or another. They always have some unbelievably strong area, like, whatever it may be. I mean, I have children who are just unbelievable with music, or just incredible with art, or or math, or they have just some area of their brain is so super developed. And for that to happen, it's sort of a overcompensation process in the brain where, if you see how, let's say as an example, is you see how people who are vision impaired or blind tend to develop really strong other sensory type capabilities, both in hearing. I mean, they can tell the difference of, let's say, when they pour something, the sound, that means it's full. You know, certain things that you develop. So when one area is weak, another area tends to overcompensate and become stronger. So I think that with our kids, that's also part of what happens, is that their sensory abilities in one area or another shifts to overcompensate for another area, and then you have incredible growth in that area. That's usually Asperger's. So I would say the answer to that, in my opinion, is yes, you are actually born with some of these brain development differences, and that's how it goes into adulthood. And it's not necessarily bad. I mean, with Asperger's, you know, we're looking at, there are certain things that you might be lacking, but usually those are things you can learn.
Right.
Yeah, and
Absolutely.
so then you end up learning what is socially appropriate, and at the same time you have these incredible strengths.
Right. Great gifts. Amazing.
Gifts.
Okay, we've got a lengthy question here. Hi, Shannon and Dr. Doreen. My question is about full inclusion for our kids who can blend in with a group. My son can blend in with peers until it involves language. He's 11, but his language is like a 5-year-old. Then he stands out. My child stands out a little bit too. Academically, he can test with his peers as long as it's multiple choice and not show what you know type questions. His IEP is coming up, and I'm all for full inclusion. However, his 4th grade looks pretty challenging. I just know that with the 2 hours of resource room he gets in 3rd grade, I know he's missing large chunks of the curriculum. I just want a team who knows how to differentiate his tests so that he can stay in his classroom. My question is, could you do a show about inclusion for our kids and how important it is to have those supports in place and role models? Thanks.
Yeah. That lot of really good points in that email, and this parent is absolutely right. This is a very critical point in your child's life, because things could go wrong, and with careful consideration and the right group of people, things can go very right. So there is quite a bit of difference when you're going into like 3rd, 4th, 5th grades. Those you are right that he's probably missing quite a bit of stuff being in resource. You are right that he will have a hard time with kids as you start to go into like 4th and 5th. Kids become a little bit more mean, you know, and I don't want to say mean, but I mean, it just becomes a little bit more competitive, less empathy at that point in life. And so it would be important for your child's program at home to be focusing on things like social conversation, how to join groups, how to pay attention to their topics, all those types of things, so that your child is able to, I find that, I guess if I wanted to kind of identify the one thing that we really try to teach our kids it's that whole perspective taking thing. It's to be able to come out of their own point of view and shell and pay attention to other people's everything, like their facial expressions, their moods, their preferences, their interests, all of that sort of thing. Because if you're able to do that, and if you're able to just be more of a receiver of their information, then you're less likely to be left out, because kids will want to kind of interact with you. I think what happens with our kids is that they want to talk about something that they're interested in, or they want to focus on something that they're interested in, and it becomes somewhat egocentric. And when you're with adults, the adult will always try to interact with the child, but another child won't. Right. The peers will just tend to walk away or recognize the differences. I'm not sure what level of deficit the language, this child's language has, but...
She said he's 11, but the language is at a 5-year-old.
Right, so it's going to be pretty hard for him, and I would really be certain to have a intensive program at home where you're working on catching up some of those language factors. Otherwise, you are absolutely right that he will be left out.
Yeah.
And those are some of the things that are very important. I really try very hard to integrate my kids into mainstream when they're pretty close. Not you know, like let's say if he's going into 4th grade, I would feel more comfortable with his language functioning if it was more that of a, let's say, 8-year-old or a 7-year-old. But you know, you have what you have, and he's in a, if you like the school program, then obviously you have to spend time at home on the weekends and the evenings and just focus on very specific skills that would help him in the school setting.
Right.
And yeah, it's tough. This is a very tough period of time.
Yeah, but I guess...
And we can talk about, we would love to do a show about school inclusion.
Yes.
There's a lot of different issues to consider, and the success really has a lot to do with if your child has an aide in the school and how the aide behaves and what the aide does.
And I have to say, I'll have to find the article. There was a great article that was done a little over a year ago, and it was Mark Sirkin who did the article. He's the same gentleman who does Hacking Autism. And he did a blog about a school, I want to say it's in the Pacific Northwest, where they base it on technology, but it's an inclusion school that requires there be a certain percentage of kids in the classroom who are dealing with other issues.
That's
and
great.
They make it a part of their curriculum that it's good for all of the students. The teachers in the first couple of years had some trepidation about it, but they're now, everybody's on board, and it's an amazing model. I'll find that article and I'll put a link to it on our Facebook page, because it was very inspirational to me to see and to hear them talking. They interviewed some of the parents of the typical kids. I hate saying typical because I don't know that there is such a thing as typical, but you know what I mean. And the parents were saying how beneficial it was for their kids to be in that classroom with children of all capabilities. Yeah. But they were learning to be in the world.
Absolutely, and to have a better understanding and more empathy, and I find that's very, very true. Yeah. But there's a lot that goes into good integration procedures. I'm not even sure. I'm thinking about how we would present that in a show, and perhaps either we can spend a whole hour talking about it, or you know, some other things we could do is I can make sure that some of our presentations are on our website. I'm wondering if IBT has some stuff. I think IBT probably already has something about school inclusion, quite honestly.
I think they do too. We'll take a look at it during a break and see, but I think that they have something. And that's ibehavioraltraining.com.
Right, and they might have a video module on integration. But there are a lot of procedures that we do. Everything from the location where the child's therapist or aide stands in relation to the child, that changes over time. Whether or not the child knows their aide changes over time. The level of participation of I mean, there's so many things that you can do to help your child, but not necessarily stigmatize him.
Absolutely. And since we brought up IBT, we had an email question come in about those trainings. Somebody wrote in and said, I went on the IBT training site, but I'm not sure where to begin. Does it matter what training I do first? I have an 11-year-old daughter who is nonverbal.
Well, if you're a parent, you need to go to the parent section, first of all. And I would, you know, the concept is, I personally think you should probably go through all of it, because it's very, very basic stuff we've put in there. And I think it's really important for you to start from the beginning, because you need to learn the basic techniques, because the basic techniques for us become our language. It's not like you're not really learning a technique that you only use in therapy, right? I mean, you know this. It changes.
You can use it every day, in every interaction.
Exactly. It's your whole modality of communicating with your child. It becomes like, you know, how do I prompt my child? How do I reward him? What types of questions
should I ask? How do I prompt my husband? Right? I mean, it becomes something that it becomes part of your tool belt.
Absolutely.
To use in every interaction.
Absolutely right.
This morning I had a driver who was in front of me and I did not use my tool belt. And I came in and I said to Emily, I'm not doing what I talk about here on the show.
So funny.
Right?
That's very funny. No, it's true. I mean, you want it to become part of you, part of your language. Yes. And then it becomes really easy because you're doing it all the time. And so I would suggest you do go through the basic ones. I think there's one already on nonverbal communication or augmentative devices or PECs. And I would seriously suggest you do that one if your child's nonverbal, because that'll help you get started on a nonverbal program, which is critical to nonverbal kids.
Okay, we've got a bunch more questions coming in, and we're going to stop at 11:45 to bring Julie Matthews in. Are you okay to keep going without a break?
Oh, absolutely.
Okay,
sure, no
all right,
problem.
let's keep going then. Somebody wrote in and said some of the show could involve differentiated teaching methods. So, what a great suggestion. Love that. Okay, here's another question. Hi, Dr. Doreen. My 9-year-old, who still has a long road to recovery, who was talking okay, has for the past 3 to 4 weeks started talking in a sing-song way. In the first week, I encouraged him by mistake, as we all will do from time to time, right? I encouraged him by mistake as his volume was more than I thought he was trying. I thought he was trying to talk loud. He had a somewhat low voice, and I, his mom, always encouraged him to talk loud. In the second week, I started getting concerned and started ignoring the tone. In the third week, however, I asked him to say nicely and even modeled how to talk half of the time. But he still repeated in the sing-song way and continues to do so. I do not know how to identify the function of this, as I am totally ignoring this now for the past 2 weeks. Is there no extra consequence by his no extra consequence to his tone? So she's not doing anything about it. Any tips would be great. Could this be self-stimulatory behavior? I am worried if something has changed in my son's voice, but I hope not, as sometimes in the night or when it's urgent, he talks better. Interesting to identify that. And thanks so much. So a lengthy question.
It's a great question, though.
I love that she detailed, I tried this, and now I'm doing
fabulous.
this, now I don't know.
Clearly this is a mom who has some behavioral training, because she's like, I don't know what the function of this is.
Yes.
It's awesome. So very kind of easy to communicate with someone who already knows some of the behavioral stuff. I would say I don't consider it a self-stimulatory behavior necessarily, because it's pretty much happening all the time now. I would say your child probably either saw it, let's say on a TV show, or is really trying to imitate what he thinks is appropriate sounds.
Okay.
So you have to think about the fact that if we have our kids, and you know, this is perhaps to him, this is speaking louder, and speak nicely won't mean anything to him. Mm-hmm. So the way I would initially approach it, I wouldn't necessarily think that it's self-stimulatory right off the bat. If the rest of this stuff doesn't work, then you might think that it is self-stimulatory, but you can stop it simply. I mean, it sounds like your child is really at the point where they understand consequences. So I would imagine that he's simply trying to imitate intonation, and because of the way that he hears it, he's not getting it right. And that's all I would really assume that it is. The way that you want to deal with it is teach him to pronounce and intonate different sounds. Mm-hmm. So instead of focusing on the overall thing that he's doing, start exercises that will teach him the difference between loud, soft, mm-hmm. high, and low, like when you ask a question versus when you make a statement. All those types of things. A speech pathologist can probably help you with this as well. Mm-hmm. But you know, there are also audio tapes that are on intonation and correct intonation, because people who come from other countries also have issues with this. They don't know how to, they have different ways of intonating their speech, and you know, the sound level goes up and down differently. So this is, it's not a huge deal. I wouldn't worry about it too much, but I would just understand that he doesn't know what it means to, when you say speak nicely. So you might want to model for him every time how you want him to say it. And if he really is trying to do it correctly, then he will model after you. Okay. If he has a hard time hearing it, then he'll need a lot of practice, because he's receiving information differently. You can use headphones that might help him, because that's what a speech pathologist would do as well, is to localize the sound that he's hearing. You can use headphones and speak through those.
Okay.
But mostly, if you find that, no, he gets more silly, or he gets just, he reacts negatively when you try to model it for him, then it potentially could be self-stimulatory. But I really don't think so. I really think he's trying to imitate sounds the way he hears them.
Okay. Is this a case where using a tape recorder or videotaping them and playing it back might be helpful?
It might be. It depends on the level of awareness of the child.
Okay.
Like, if you tape record it and play it back to him, again, he might not even tell the difference.
Okay.
If you contrast it to other kids, he might not be able to tell. I'm not sure what he's receiving, so I don't know his auditory levels.
Right.
But I think if he's changed, then that means he's trying to change, and so he has been hearing something.
Yeah.
And because the change occurred after, I guess, parent was trying to tell him to speak louder.
Yeah.
So, another thing you could try is to try to tell him to soften the voice a little bit, but model it for him. That's really important.
Okay. Really great question and great answer. Okay. Somebody has written in that they're celebrating because they just watched their child in gym class climbing the climbing wall. The whole class encouraged and cheered him on until he reached the top. He beamed. They write in, I love this gym teacher. What a blessing to see his typical peers encourage him that way. No question, but we love to do the celebrations.
That's awesome.
That's absolutely great. Somebody wants to know what has been done with biomarkers for this illness. And I'm not sure whether they're talking about defining autism as an illness or one of the other things that we talked about.
Yeah, I mean, there have been some biomarkers that have been recognized, but they're always biomarkers that will only identify a very, very small segment of the autism spectrum population. So, in other words, there might be specific biochemical tests, blood tests, or even genetic tests, but they're always identifying a small, tiny segment of the population, so they're not that meaningful yet. So over time, we're hoping that there will be enough biomarkers that will identify the subphenotype of autism. There are a lot of people who are working on this. There's a lot of research being done on the development of biomarkers. I'm not sure that it's all that meaningful just yet. I think some of the basic blood tests that occur right now, they're not meaningful in terms of a biomarker for autism, but they are meaningful in terms of medical treatments that could benefit the child right now.
Okay, great answer.
Yeah.
We had a follow-up to the question about the singing that the mom or dad, the parent wrote in and said he watches very, very less TV but loves music and always asks for song. It's his strongest reinforcer, reserved for great accomplishments.
Was that the child who was
speaking in the sing-song voice? I assume.
Oh, that's the same child who was speaking in the sing song? Okay, so he's trying to sing. He's confused between speaking and singing, perhaps. Okay. And so you need to just make that black and white difference for him.
He's a Broadway kid in the making.
That's right. This is singing, this is speaking, and this is how we do this one, and this is how we do that one. And if he's enjoying singing, then make sure that you give him the opportunity to speak that way in a sing-song as a reinforcer, and actually turn it more into song so that the difference between speaking and singing becomes more clear to him.
Okay, great. Somebody else wants to know, are more special needs schools opening in states that don't offer insurance coverage? Are you looking for other ideas that can be suggested? Do we have a blog? We do have a blog that is just starting this week, but you can always talk to us on our Facebook page or all those different ways that we like to show you here. But to answer the question about more special needs schools opening in states that don't offer insurance coverage, I think it's more the exact opposite, isn't it? That schools are opening where the insurance coverage comes. It's like one comes, you get the insurance coverage, and then more services show up.
Right.
Which is one of the reasons why you should fight for the insurance reform in your state.
Absolutely. I mean, it's very difficult, and I would say we have we have an ongoing list of parents writing into us and asking for us to open sites in various locations, and we will tend to look at the locations where A, there's a lot of parents, but B, there is funding, because coming to that location and setting up becomes really hard for families if there isn't funding.
Yeah.
So in the meantime, we do have the remote services service at CARD, which is essentially we send supervisors to hire and train, or just to train for you. Like, for if there isn't any funding, the way that we help parents is we'll send a supervisor to you, but all you're paying us for is the supervisor training people that you hire, because that's going to be cheaper than if we hire them. And we will train them. We'll train them just the way we train our own people, and we will oversee them, supervise them, but they remain your employees so that you can pay them much, much less.
Yeah.
And as I've said many times to parents, they don't need to be college students. They can be high school students. They just need to be people who are reliable and interested in helping kids. And then we will train them and get the program going, and then the supervisor comes back and forth to you regularly and does in between their monthly or bi-monthly visits, they'll also do a lot of Skype supervision and that sort of thing. So it's very doable. You will, as you said, Shannon, it's probably less likely that schools or centers would be opening in those states right now. But I mean, we're up to, what, 32 states now? And every time I look up other states, they're in, I mean, it is, a lot of the other states are also looking at this right now.
Absolutely. So the map keeps changing. It keeps getting better. We're moving in the right direction.